Thank you so much. Thank you so much for taking the time to be a part of this webinar. Well, I would like to thank each and every individual on behalf of CapMinds, and I would also take the opportunity to thank the doctors and the importance of what we are going to discuss. All those is a little bit in the future. Uh, Although it's going to be a little bit about things in the future, I'm just going to state that it's very important because healthcare is going to touch each and every one of us, and the contribution of OpenEMR and AI integrated is going to be very, it's one or the other way has a direct impact on everyone, who's a part of our webinar today. So another thing is that you can definitely ask questions in the comment section, and towards the end, I'll take the time to go through all the questions. So please, if you have any questions, post them up. I will definitely go ahead and look at them towards the end. And well, I would also be a little honest about certain challenges or I wouldn't put it across as a challenge, or I would put it across as a temporary situation with LinkedIn when we do webinars. I think the platform has capabilities to there are some functionality capabilities that could be enhanced when it comes to LinkedIn webinars. So we are also a part of it. So I would just request you to bear with me if in case my attention is a little bit here and there, because I'm just reading out, or operating from multiple systems. So, and first off, I would also take this time to thank CapMinds as a company, because we as a team are very, very passionate about serving the healthcare professionals because it enhances healthcare. And globally, we have been able to achieve that. So I would take this. It's only justice if I go ahead and thank the team, our team at CapMinds, and special thanks to our CEO for making this happen. And his passion to serve the healthcare industry has been one very contagious, and we have all been, have share his passion, and he has also. So I would like to thank him. And pretty much, I would say before we get into some informative content, I would be discussing or I would be elaborating about them. Well, the tech we are discussing right now would seem futuristic, because given that I interact with doctors and healthcare professionals, we as a team have found that there is a lot of gap in the kind of technology that actually exists versus the criterias that doctors uh, consider when they are opting in for a EHR, and the other related services that go along with the EHR. Now, so I'm going to discuss about certain things. Towards the end, I will show a pretty small test screen of how the technology would look when it is developed on EHR by CapMinds. And the technology is just going to look very simple right in plain of your eyes. If you expect some dynamic things to be there, it's just going to operate plainly with the software. It's just going to enhance, and those details I will be delivering throughout the webinar. Well, what we are going to do, I have kept a very simple agenda. Well, we will be discussing some information, and then we will be exploring a simple live demo, and I will be showing some certain screenshots, because I wouldn't be in a position. They are all test screenshots and completely compliant with HIPAA, so they are all, So I would just be able to give you a gist of what these tech would look like when they are developed on OpenEMR. And so, as we know, the table of contents, just an introduction to OpenEMR, the challenges faced by doctors, using the traditional EMRs, or I would say in general, the criterias they actually, strike in their, criterias to consider an EHR. So the challenges faced by it, how AI will enhance the particular operations, and integrating third-party AI, and developing the very own AI in OpenEMR, and the benefits of those integrations. So as we all know, OpenEMR is an open source practice, I think you can very well go ahead from the screen and read the practice management solutions deployed across the globe. I will mostly go ahead and elaborate about our journey at Capminds in being able to deploy OpenEMR globally. We have made a difference in global deployments of OpenEMR, not just in the North American continent, which we highly specialize in, but our service-oriented nature has also gone ahead, and we have made a huge difference in the healthcare system globally across regions, including Africa and many other regions, where we have gone ahead and implemented OpenEMR. And OpenEMR in itself is a very nice open source software, although it doesn't come in a readily operatable form. It's, I think, a very huge contribution to the medical society. Especially, I would say that one of our founding members, the founding team members of OpenEMR, is presently the founder of our company, who's highly passionate about making a difference. So, when it comes to OpenEMR, it's used by close to 45,000 practitioners. I think that number is pretty low. They've kept it low because I know the number of practitioners using OpenEMR. And OpenEMR as an application was comparing to the huge giants that there are in EHRs, would beat the huge giants in many sorts. And if you take the criterias, well, OpenEMR would give you the control or the control to the facility or the administrator of an independent clinic to any kind of medical practitioner across any specialty when he or she is looking to start their practice. I think it would be best for them to invest their money on the Capminds OpenEMR, because we would make it highly workable. OpenEMR in general has challenges to function because it's actually an open source. It's actually left as a place where very specialized developers could actually implement certain features on it. And given the amount of features that can be explored in OpenEMR, is just a very highly community serving platform, one to be considered even when you go against giants, in the EHR platform. The core features of OpenEMR are not limited to the three that we see on screen. The patient management, 100%. The medical billing, 100%, including the revenue cycle management for the United States, and insurance billing for various other African countries that are still developing their insurance electronic claim inclusion. And we have gone ahead and globally helped many countries make a difference in their healthcare by getting OpenEMR to operate at such a robust level that because it touches a lot of people, and healthcare is all about managing pain, and the health part of the community is one of very important. So when it comes to the kind of clinical decisions that our physicians were able to make, and the kind of customizations that we worked on with Capminds with OpenEMR, is in depth and very robust. It cannot be explained in a webinar. Each and every case is so specific. Patient management, electronic prescription, lab orders. You can go ahead and if you have a multi-specialty hospital, then you can go ahead and develop modules on that. We have done that, so it takes high level of expertise in getting those things done. So yeah, interoperability and security. It is compliant with every single regulatory policy that exists across the globe. So it can seamlessly exchange data within healthcare systems, and the ones that are highly HIPAA compliant. So yeah, so the security ensures compliance as well. So, as you know, the challenges faced by doctors using traditional EMR, and the thereby affecting on the entire healthcare stakeholders. Despite the adoption of EMRs in healthcare practices, doctors often face a lot of challenges. Let me tell you that uh, when there is an EMR that you have, and you have gone for the EMR, and you see a particular, no matter what software, in fact you can apply it to EMRs more because it's of high importance. It has to be highly workable. So the customization part of it is very important. What I see and even I know providers, many providers feel that when they consider an EMR, is that which of their workflow is actually helpable for their particular purpose or their particular operations, as well as the staff, so many other stakeholders it affects in the process. Now, the customization is not offered, so you have to adapt to the workflow of the work of the particular platform. With OpenEMR, you have the customization option, which actually makes sure that OpenEMR can be customized to your workflow to enhance whatever you're doing in your flow. So you have a software that can be customized to a certain extent, so and has it's highly secured as well. Well, as you know, the manual data entry and administrative burden has always been, very, very tough to manage when it comes to the healthcare providers as well as the medical staff. They are also like always into data entry and the other ones. Well, the traditional EMI, I think they lack intuitive interfaces. When it comes to the traditional EMR, you're limited to a particular view. That's the best part about OpenEMR and why it was a success globally, because it's like a canvas and it's open to skilled developers, highly skilled developers, because this is healthcare. You cannot be practicing or trying to build up. It requires one of high skill. So when the implemented solutions and the more customizable that they offer, everything is going to be very, very highly customized. You won't have to feel the burden of changing into a new EHR or anything like that. Well, as you know, the difficulty in extracting insights from data. Well, standard EMR store vast amount of patient data, but making sense of this data for real-time decision making is difficult. Uh, the data has become a huge problem, as you know. There is vast amount of data that's accumulating in the medical industry. Uh, After things have started to get digitalized, one way or the other, things are getting digitalized, and everybody is adopting, the platform. So the data management and extracting the proper clinical decision making related challenges for the doctor is actually a bit high at this particular time, because data is available and the methods to actually view it is still in the testing phases. So that's another one. So this is what I really wanted to. I was really excited to share about the role of AI in AI in healthcare. So as we know, AI is transforming the healthcare landscape. However, I can 100% tell you that when it comes to the healthcare landscape, the entire workflow challenge that a physician faces when he comes to, and as well as various other criteria, the support for this and the various other integrated platforms, you know, you are forced in a particular place where you have to make a choice which has a certain bundle of offerings, and the bundle everybody faces that challenge. Physicians are currently facing the challenge in the market. These things come bundled along with the particular thing. So I think when it comes to the open EMR and the AI capabilities that Capminds can infuse in open EMR, that actually shifts the entire focus towards the value-based care. Well, well, processing large data sets and offering real-time insights, whatever's going on, the notifications, so we speak. Insights is nothing but just notifications. It's just simplified. So when you look at the notifications or you look at a dashboard that gives you various analytics, it becomes very easy from a provider standpoint to make a clinical decision. And these technologies are very, very extremely accurate. Now, their capabilities are only limited to providing, say, about like 25 right now. I say limited, the word limited right now, because as we speak, it's evolving. Machine learning has been highly induced in these modules, which I will talk about later. So you can notice that a lot is evolving at this. It can analyze patient data to predict outcomes. It can warn the provider. It will be in a position to notify the provider in such cases. So now we are going to talk about integrating third-party tools into OpenEMR, because OpenEMR has a capability to integrate with any third-party application which has open APIs. We'll create an FHI. So integrating AI as a third-party tool, it's I would say seamless because the kind of effort that we put, the team at Capminds had put for doing such integration has been has been very very understated. And when we actually implemented those solutions for our clients, well, I believe the difference that they are making and the enhancements that they are making is also hand in hand with the scaling of that particular healthcare organization. So it would just function seamlessly. So in developer terms, the data will be input and data can also be extracted out of it. So it's very tailored to your particular workflow, because see, when it comes to healthcare as a particular vertical, it's so deep and you have various specializations going on within them, and the staffing of the each and every particular entity in healthcare facility within the specialization, the strength of the organization versus the roles they play, and the kind of roles or the kind of multiple roles that they have to play in small organizations, or the kind of split roles that they have to play in large healthcare facilities, which we did for a particular country, which when we were able to cover the entire landscape of that whole country, and we were able to understand, the difference that and the deep level of tailoring that needs to or the customization in simple words that needs to happen. So we can integrate a lot of tools with lot of AI tools can be integrated into OpenEMR. AI integrations will also enhance OpenEMR's capability, and EMR, which is customized to your workflow with AI integrations on it, is just going to give you one of the best outcomes that every physician out there is, I would use the word obsessed, because they have their work methods and they have their work order, which goes down to very, very extreme details. And I think that will actually, these technologies will actually supplement the doctor. It would just act as a very useful assistant. So uh, the voice recognition dictation module. So it's nothing but the spoken words. Um, get converted into text. As simple as that. The module uses, however, this AI enhanced one. It will use an NLP, so the natural language processing, and those are algorithms to transcribe medical notes, create patient records, and update clinical documentation in real time. And the best part is that the AI system can understand the medical terminology and the context of it. So the terminology and the context are kept very much in aligned, because that is where the context is lost in any discussion that goes for over a period of time. When it comes to the healthcare medical terminologies, they are very critical to human life. And uh, aligning the medical terminology of the particular doctor with the context ensures, or it just makes a very huge difference in the accuracy level. And the need to make medical corrections is highly reduced. So that is one very useful impact. And doctors can quickly dictate the notes, reducing the time spent in the manual documentation, allowing them to focus more on the patient care. And it's also a very reduced burden on the staff as well, because they can also move on to very important tasks, and instead of correcting the dictation. And yeah, real-time transcription with AI, the AI that Capminds will integrate with OpenEMR or develop on OpenEMR. And that through that, it's just going to ensure that patient records are updated immediately, enabling very fast decision making. So it's also consistent, and it's also compliant with the compliant with all clinical documentation. So yeah. So when it comes to the predictive analytics, well, what I can say is that AI-powered, predictive analytics help doctors identify, so to speak, the potential risks, such as the disease progression or readmission, enabling very early intervention and prevention, is better. So it's just going to improve their decision making, and very optimized staff resource allocation. So whatever staff you have, can be optimized to attend to the places where it requires huge, that the requirement would actually shift towards, and enhanced patient care. Once again, everybody is affected through this particular event. So, when it comes to the clinical decision support, so I'm just going to address that as CDS. However, I'll try to elaborate. So, uh, it's just going to you can read what is available on the screen. You can simplifying that, it's just going to have a very, very improved diagnostic accuracy, as simple as that. So, it provides doctors with real-time, AI-driven diagnostic suggestions based on patient data. That's going to help a lot in their decision making, because the decisions that doctors make, they have always had to go through some data, and with the help of AI, they are just going to be in a position to make more accurate decisions. It's going to affect and change the entire healthcare. So, CapMinds has already implemented that particular implementation, and it has shown difference on the very from the very second week. They were able to make very, very accurate. It's for a specialty, and it's for a client I wouldn't be in a position to state due to privacy policies. However, the implementation has been functioning very well for the past 7 weeks, and we have been able to do that. There are huge challenges in doing these kinds of specialized work on AI. See, right now doctors are considering, or medical practitioners are considering the criteria which I said earlier, are based on whatever is available to them, and they would streamline whatever is available to them, because you'd like to simplify, but details hold a lot of importance. So when it comes to the criterias that the medical practitioners go ahead and consider, I would highly request you to consider having a word with our team at CapMinds about the kind of customizations that we could do on OpenEMR, because OpenEMR can integrate with AI, but it is not very easy to do that. It takes high it it is very easy for our team to implement it, because we are engaged in that activity 24/7, and we are able to go ahead and deliver that. So when you say the normal criteria that an EHR is being considered versus that kind of tech I'm talking about, it is going to make a huge difference. The only gap is that there is some kind of a hesitance in a pre-assumed thought that these tech would be more difficult to learn, or wouldn't be. The biggest misunderstanding is that the change of any application, or change in any application, it's when you're not supported amply enough, you're going to find things difficult. So when you get the help that you require in everything, you're going to go ahead, and our team will also be there. So it would be very, very easy to go through that entire change process. And just imagine these kinds of technologies being implemented globally, instead of the very few people that we have been able to get this across to, would make a huge, huge difference. You know, they get clinical decision support, the CDS. They get evidence-based treatment recommendations. So it's hugely supported by evidence. When AI comes into play, it's going to take in the big data, and it's going to be functioning very, very accurately. So these are technologies that are highly proven, implemented, but the gap in the industry is that it's not being told to the medical practitioners, and that is the main aim of CapMinds as well, to go ahead and keep them informed. And you hold 100% control when you operate with OpenEMR. Let me advise you that, versus any other uh, thing. And even when you talk from a developer standpoint, it will beat it. I can go ahead and engage in that nerdy discussion as well. You can hit me up in the comments column, please. So yeah, it's going to detect the clinical decision support. It's also going to detect early detections on the health risk. Everything is going to be centric towards betterment for the doctor, directly affecting the patient. So when it comes to the remote patient monitoring integration, I think we have enhanced chronic condition management. So It's doctors can continuously monitor patients' vitals such as heart rate, blood pressure, and being very over the surface. So in real time, and it's just going to help them manage the chronic conditions like diabetes, hypertension. Proactive interventions happen when AI comes in. So real-time alerts show to detect the health potential risks and the improved workflow, that the entire medical staffing gets from it. Once again, better patient engagement, better patient outcome. So when it comes to the AI part of medication management and adherence monitoring, it's very simple. You can go through what's there on the screen. I would just simplify that for you. It's real-time tracking and alerts for drug interactions and all the medicine interactions and adherence issues. Reduce the risk of adverse drug events. So ensuring safer medication use for all the patients. And these directly impact in the treatment outcome. So, very optimized decision making is actually helped when this particular AI is developed on OpenEMR by Capminds. So, automated coding and billing module is very simple. Well, it's just going to improve the accuracy of coding. So, AI-driven medical coding and documentation, tool integrated with OpenEMR, one of our partners, so to speak, can enhance the coding accuracy. So it integrates with the OpenEMR and to automate the coding and billing tasks, compliance and regulatory policy compliant. So this is a very interesting AI, the image recognition and diagnostic support module. So when AI comes into this module, it's going to provide analysis of X-rays, MRIs, and CT scan to ensure the detection of abnormalities on a very extremely precise level. So that is where AI plays the role. It's going to just process data that is just going to take on a very quick processing. It's just going to take a lot of time. It's going to come out with those kinds of diagnosis. So the radiology workflow will also be very enhanced, and the patient care can be highly proactive with the AI that we integrate with OpenEMR with image recognition. So these are the key benefits of integrating OpenEMR. So, it delivers very transformative, a huge transformation in healthcare, automation of tasks, providing real-time insights, and very streamlined clinical workflows. When these things are in place, and over a month, when you go ahead and keep on working in them, it's just going to be a breeze working, because you're just going to talk and it's going to do rest of the work. The coding is going to be automated, and so many things can be actually very streamlined and reduce the workload on the staff. Well, like I said, everything that we spoke about during this particular, I'll let the slide remain for a couple of seconds so you can go through it. Everything revolves around enhancing patient care. The real-time alerts and recommendations, it can flag high risk, and it can also leverage the patient data, to design individualized treatment plans that align with the patient's, because every patient is different. So with the patient's very unique health profile, AI does that. So thank you so much. I hope I was informative, and thank you so much. Let's move into the a quick demo. What we are going to do through this demo is very simple. We are just going to go ahead and check how an appointment is made, and how a staff goes from scheduling, or the front desk goes from scheduling for any type of a health institution, for large hospitals, to anybody, and how the particular appointment is created, and how the doctor would be going ahead and adding their soap notes. It's as simple as that. Now, It's just a demo version. I'm just going to give you a very, very quick overview. Just give me one. So as you see, this would be the very first screen when you log in. Uh, it's so user friendly for the patient, for the providers and the healthcare staff. All the modules are listed horizontal. So this is a customized OpenEMR. So it is not how OpenEMR would look. Our team has put in some customizations. However, there is no backend, so it's completely very friendly for a demo for the public view. So. So if you look down, you will see that, all your users are listed and your facilities, you can just click here, your clinic name, you can just click here. So it's very simple. So when you click on any time, you can just go ahead and simply create an appointment. This case, I have already created appointment. You just have to go ahead and very simply one of the first things is that when it comes to the patient, when you go to the patient list, you just the modules I will explain them. Finder is nothing but just the entire list of patients that you have. You can go to any patient, you can just go ahead, click on them, and once you have their, this is where the medical staff would actually take in the vitals and all their entire e-prescription, that's already been integrated, everything. If there are documents, you would go ahead and have them entered here. And when RPM is integrated, this section would actually show the RPM. And when the doctor is doing some kind of telehealth solution, you see the clock here is already clicking. So, that's actually, you can pause it once you're done. You can resume it once you're continuing. So it actually helps you with the billing part of it. And you can just go to visits and create a visit. As simple as that. You can make it an office visit, nothing but just where the patient goes to the the facility. And as simple as that, the doctor right now can get started and simply go to the most important. I'm just going to show something which is very generic and used across the soap notes, and you save it, and everything that you save comes here. So when you want to go ahead and send for any kind of lab orders, you just have to go to orders, order a procedure, and since this is just a test account. So everything that the provider does start reflecting in their particular finding. It's very, very simple. And you can just go on with whatever functionalities exist here, which I would be more than happy to explain on the customized version of OpenEMR by Capminds. So we can go ahead and simple, very save and e-sign on. Okay, so since this is actually, so when you actually put in the password, it's just going to go ahead and save all the clinical documentation by the doctor. So nobody can tamper with it, with his findings or his particular charting. So it's as simple as that. So this would be from the front desk to the doctor, and the respective other modules that you find on top. Finder, like I said, has everything about the patient. Flow is nothing but just, the list of appointments that you have for the very same day. You can go ahead and view them here. And doctor dashboard is the providers who are available. You can map their availability. And feedback is where a patient can actually interact with the clinic and say how they felt about the particular visit. Recalls is when you actually call back the patient. So from a medical provider standpoint, if they're going back and if they have some kind of an allergy towards a medicine, just for example, they could just immediately recall. So messages, they will have all the messages. Task manager is individually assigning tasks internally. When it comes to patients, we created a visit from the patients. The records are going to be there, the prior authorization report. When the insurance comes into play, then the prior authorization comes in. But when the patient is paying by himself out of pocket by cash or card, the prior authorization don't come in. So it's just that the ability of OpenEMR to function very, very high level of data and being in operation for more than a decade and coming from one of the founding members, from Capminds, it's going to be very, very, it's going to be built to, I must actually commend the team our lead architect as well, for making this a very, very functionable and high data withstandable. You can do 100 things with the UI UX in case if you're wondering. And you can make the UI UX look very, very attractive, very, very flashy. It's just a demo version. I'm just giving you something. So fee is nothing but everything. It's self-explanatory, everything including the fee sheet or the fee schedule of the provider that we could you know upload internally. The inpatient module is a customization when this was actually from a hospital. So they had multi bed facility. It was actually a huge facility that has patients in three digits visit on a daily basis, and the level of data they accumulate and the level we manage at with the existing is very, very commendable. So inventory is nothing but everything that you have. Like if you have an in-house pharmacy or an in-house medical dispensary for the medical providers, that's updated here. Procedures is for the lab reports and all those things. Admin, the admin of that particular health organization can go ahead and map the ACL. When you see ACL under admin, it's nothing but just access control, or in other words, mapping the users based on the hierarchy to the level of visibility that you want in terms of the information that you want them to see, which is relevant to their roles. And under more, you just have some custom settings and those kinds of things. So if you look, until I pause it, it's still in the RPM, it's still in the dashboard reviewing. If the RPM had been integrated here, we refresh it, we will get a updated data. This is a quick dive into OpenEMR, very wonderful application that you will own when you develop it on OpenEMR, and you have equity when it comes to OpenEMR. You very well understand as doctors, when you go for it, the patient care is going to be very, very enhanced. And at the same time, when CapMinds goes ahead and implements the solutions, they are very, very workable and implementable. So, yeah. Thank you so much. I think we have gone 6 minutes overboard. So this is just a very simple AI. See, but like I said, it's not going to look very dynamic. We've made it look very, very simple. It's just a very test sample. So when it comes to AI, if you look at this part, right, you see the speech dictation is already on. The AI has already predicted whatever it needs to, and this is when the dictation is working in live, and this is before the dictation can start. So it's as simple as that. When a patient actually, and if you see, it's under patient encounter, it's very simple. So even when it comes to the lots of there is always a requirement, or the healthcare staff are always understaffed. So because the level of patients or the level of medical conditions, they increase with very, very different patterns if you look at it. So these kinds of features, they come in very handy, and you get by providing the utmost best care as a healthcare provider. And the patients, the benefits that everybody, each and every one of us gets when our solutions from CapMinds on OpenEMR is implemented, is very, very huge. So that is something that I wanted to show with you, showcase towards the end. So I think we have reached towards the end of our webinar.